Today we're going to talk about something that you will experience as a parent of twins, doubly so, and that is how to deal with teething twins. First of all, is when do twins start teething? Well, if they're twins or if they're singletons, expect them to start teething between 4 to 9 months, and typically this is around 6 or 7 months. And of course, it varies from child to child. And if your babies are really early preemies, then they may take a little bit longer for that to happen. So roughly 4 to 9 months is when they start to teeth. And you'll notice that even if you have identical twins, when they start teething will be different. You may have one start teething a little bit earlier and then one a little bit later. If that's the case, you may consider yourself lucky because you only have to deal with one teething twin at a time. Plus you can kind of figure out what works and then apply those same tactics to the second twin when the teething starts. But of course there's no guarantees. Your twins may start teething at very similar times, in which case, I'm sorry, things are going to be a little difficult and crazy around your house. Your kids will start to teeth, and you'll notice probably the front couple teeth first. You may start noticing that if mom is breastfeeding and she'll start to feel those little teeth, or if you start to see the babies open their mouth and smile, you may catch a glimpse of those teeth coming in. Now, you won't necessarily see a new tooth right away. They don't go from no teeth to all of a sudden a full mouth of teeth. It's going to be a very gradual process, and during that process they're going to have a lot of discomfort and pain that's going to cause irritability and schedule disruptions. And so look for some of the symptoms that could indicate your twins are teething. So first is drool. So if your babies are like slobbering all the time, that could be an indication that they are teething. You might want to stick your fingers in the mouth to see if you can feel those teeth popping through. Your babies have a low-grade fever. And they're obviously not sick with something else like the cold or flu or something, but they have a kind of a low-grade fever that could be indication that they are teething as well. Now, of course, if you feel them and they're warm, make sure you take their temperature and kind of validate what's actually happening. If you also notice that your babies are chewing and biting on everything that's within reach, it could be a sign that they're teething. You could help counter this by giving them teething toys, anything that's cool or cold, they can chew on and kind of numb that pain and discomfort. Your twins may just seem kind of uncomfortable and kind of cranky, right? And if you changed their diaper or they've been fed, this could be an indication that they may be teething, particularly if they're in the age range 4 to 9 months old. Another thing that often comes up from parents is they got their kids in a schedule and all of a sudden it stops working and they're like, what is going on? If you've had a predictable schedule with your babies and all of a sudden things start getting thrown out the window, then it could be a sign that they are teething and that you need to help address that discomfort to help them get back into a good routine. Now again, if they are crying for no apparent reason, you've checked all the basics, right? They're not cold, they're not hot, they have been fed, they're not sitting in a dirty diaper or a wet diaper, and they've got enough sleep, and they're just mad or cranky, it could be a sign that they are teething. Once you see some of these symptoms and you've kind of validated that they are in fact teething, that their gums are red or swollen or irritable, you start to see those teeth popping through, then it's time to find some relief. Now I'll make a few recommendations for you. Of course, you always need to consult with your pediatrician as far as what's appropriate for your twins at their particular stage of life and their medical history. Now I'll tell you what we did that was helpful to us was we used two things effectively to help our babies medication-wise when they are teething. One of them was infant Tylenol. So infant Tylenol has some dosing that you can give to even very young babies to help with the teething. And that helps get rid of the pain. And the other one was a topical painkiller called Oragel. You just kind of put it on the sore spot in the mouth, on the gums or where the teeth are starting to pop through. And it's kind of a local anesthetic that would make the pain kind of go away a little bit. If you've had any kind of dental work and they just kind of numb the particular area, this is kind of an over-the-counter version of that. It's not, of course, as powerful, but helps relieve some of that pain that your babies are experiencing. Now again, for infant Tylenol or for Oragel, make sure you're talking to your doctor about how much you should be using and when and how frequently you should be applying that to your babies. We also found that our twins had some relief when with teething toys. Usually they're kind of soft and chewable type of toys that are water resistant, waterproof, that they can just keep in their mouth, gnawing on, right? Another thing that we found relief for our babies was anything that's been cooled in the fridge. So what we like to do is we would take a wet washcloth and we would put that in the fridge, let it cool a little bit, and then they can just chew on that, and kind of the moisture and the chill temperature really help them find some relief. If you don't give them something to chew on, they're going to find something to chew on. It's either going to be their hands or their feet or their clothes, this part of their clothes right here on their shirt that can easily reach up, or their sleeve. All that stuff's going to be soaking wet. And so if you don't give them something to suck on or to help soothe, they're going to find something available. And that's going to be themselves, something they're wearing, something they're playing with, or it could be you, right? They're going to start gnawing on you, your hands, your arms, your sleeve when you're holding them. During teething, we had to kind of go back and think about what worked when they were newborns. You're going to see that your twins are going through some regression when they start to have teething. They were in a good sleep schedule, they were in a good feeding schedule, and then they start to revert back as they're going through this discomfort and pain of teething. And so we had to go back to what was working when they were infants. If you remember, when your babies are infants, if you swaddle them up, nice and tight and warm, that helps calm them down oftentimes. We also found if we put them into swings or to bouncy seats, that kind of swaying, rocking motion was helpful to help relax them. So just because they might not have needed that in the last couple weeks, when they start to teething, you may want to go back to those best practices from when they were very young to help soothe them during their teething experience. Because if it worked when they were infants, odds are it's going to work again now when they're having teething trouble. So do your best to keep your twins eating and sleeping. Now they may be resistant to that, or they may be waking up more frequently, but you have to try to keep them in the routine and the schedule. Offer them the opportunity to rest for their naps and for sleep, and as well as eating. And if it doesn't work, keep trying, try again. And hopefully when you apply some of these other things we've talked about of helping to soothe them and their discomfort, it'll help them be more open to eating and also to taking a nap and to sleeping at night. During this time of teething, it's going to be a bit of a challenge. They're going to be crying, they're going to be cranky, and remember that don't take it personally. It's not you, it's them, right? And so they're not mad at you, they're not angry at you, you're not a horrible parent. That's not true at all. And what they need is just some help to be comfortable. And as soon as those teeth start popping in, things are going to start to get better. They don't stay in this teething stage forever. The teeth start to pop in. And after you go through this a few times, babies start to get used to it. You get used to it. You know what the signs are. You know how to react. And you can do so effectively. So hopefully if you apply some of these things we've talked about today, you can get through the challenge of when your twins are teething. And hopefully you can come out on the other side of that surviving, and your twins can come out on the other side of that having been comforted by you successfully. So if you have any questions about teething, overcoming some of these challenges, go ahead and leave those in the comments on this video, and I will answer those there. Thank you so much, and have a great day.